Hi, my name is Rebecca Arizmendi. I'm the President CEO for the Greater Pharr Chamber of Commerce, and welcome to our first Chamber Chat. Our first discussion is going to be, of course, with our Mayor, Dr. Ambrosio Hernandez, and some special guests from UTRGV. We have Patrick Gonzalez, Associate Vice President of Marketing and Communications, and of course, we also have Dr. Michael Dobbs, and he is the Chief Medical Officer for the medical school. Dr. Michael?
Good afternoon, everyone. My name is Michael Dobbs. I'll go backwards just for fun. Got to UT Rio Grande Valley and the Rio Grande Valley itself almost a year ago. Moved here from Kentucky with my family. I'm very happy to be the Chief Medical Officer at UTRGV and also the Chair of the Department of Neurology. We're a growing department and a growing medical enterprise overall. And you know, this COVID-19 pandemic, I think, took everyone a little bit by surprise. We could see it coming and had some time to prepare, but it's really challenged all of us, and it put a lot of stress on the whole healthcare system nationwide and here in the Rio Grande Valley. And I do want to say I'm very proud of what UTRGV and the healthcare community on the whole in the valley has really done in response to this disease. Before I was here, I was at the University of Kentucky for 13 years as faculty there. I'm a stroke neurologist by background and took care of thousands of stroke patients over the years. Spent a few years in Texas before that while in service to the United States Air Force. Lived in San Antonio, Texas, and so in a way this was kind of a homecoming for me and for my family to come back to somewhere that we really did like to live, even though at heart we'll of course always be Kentuckians. And that's about it about me.
Wonderful. Well, thank you, gentlemen. As you guys know, I'm Dr. Hernandez, the Mayor of the City of Pharr, and I'm a second term. And we've been working in collaborative efforts with UTRGV. After today's discussion, we'll find out a little bit more about our COVID-19 issues, but more importantly, in my opinion, the real impact that the medical school has on our community, not only from an economic standpoint, but also their contribution. Before your arrival, gentlemen, there was always questions, doubts of what the university medical school really could do and why you actually need one in the area. There's really not a benefit. There's a bunch of doctors around. You don't really need one. And there's hospitals. And I think this pandemic has really put the importance of having a medical school, and that's what we're going to get into in a little bit. But for one, I'm Dr. Hernandez, Mayor of Pharr, and welcome, gentlemen. So I'd like to start off with first informing our public, and obviously we all know we have a pandemic on our hands, COVID-19, gentlemen. We know where it came from, so we're not going to get into that, but a couple of things we'd like to discuss with you both is what are on people's minds. A lot of times when we, as elected officials, interact with our population, some common themes come up, and I'd like if you could expand on those after I ask these questions. One is, you know, why do I have to worry about this? It doesn't affect me. I'm 22 years old, I'm healthy, I run, you know, I drink a little bit, but you know, I have a little bit of high blood pressure, but all in all, I think I have a rocking body, I look good. So why should I really be bothered by this?
Are you talking about yourself or a hypothetical person there, Mayor?
Oh, I didn't know you caught so fast, yes. No, sir, hypothetical.
Hypothetical, okay. Well, you know, this can be a very bad disease for anyone. And yes, the odds are in one's favor if they're young and healthy of having a good outcome from it. But we do know that indeed it can kill people at a young age, even who are very healthy. I don't have to tell you this as a doctor, but there's this principle in medicine of there's the disease agent, like a virus, and then there's the host, which is, you know, the human body in this case. The disease occurs when the virus and the host fit together in a bad way. Mm-hmm. And so an individual's body chemistry, the way that our atoms form into molecules, like a puzzle, can actually make individuals more prone to suffering from a particular infectious agent like the SARS-CoV-2 virus. And we don't quite know who actually is going to fit in that way. So while we do know that people with underlying conditions like poor immune systems cardiovascular disease, the elderly, people who don't take good care of themselves and are very out of shape tend to do worse. Just being in good shape and young does not guarantee protection at all.
So that it would be pretty accurate to say that just because I am 18 years old, I don't have any comorbidities, that is, I have no other illnesses, it's accurate to say that I'm still at risk.
Oh, yes.
Okay.
Yes.
And the concern that we may have is there's a certain population in the Rio Grande Valley, including the city of Pharr, that are walking about, and although they may perceive themselves not being at risk, the fact is, if they are a carrier, and if you can explain a little bit what that means, they may be putting other populations at risk. Is that accurate?
Yes, that's absolutely right. I remember several weeks ago, in the early stages of this pandemic, before it was declared a pandemic, people were saying, health officials were saying, hey, this thing might be transmitted when you're asymptomatic, before you even show any signs of infection. And I just took a big deep breath and said, oh, this could be bad.
Yes.
This is the one that could really escape in those asymptomatic carriers and go all over the world and infect people before we really know what's at us. And yeah, that happens. That's why we've been in a situation where we're staying at home and really limiting social contact. I mean, if you would have told me that we would be doing that 2 years ago, I would have argued with you, you know. But it has saved a lot of lives by keeping these asymptomatic carriers from infecting other people while they have the disease and are putting it out into the air and just don't know.
Right. And on that same topic, so children, they always come up in conversation, a lot of scared parents.
Yeah.
Some parents are a little upset that their kids don't get to go to school and hang out with their t-ball teams or cheerleading camps. And they seem to think in their minds that this is really a disease of an older population or somebody who has special problems like transplant or underlying disease. Is that right? I mean, should we be all, what's the problem with having kids run around? What's wrong with that?
There are a couple things. And, you know, as a parent, I'm actually really disappointed that my girls aren't able to be in school and be around their friends, and they're disappointed too. I'll give a shout out to my wonderful wife, who's been a wonderful at-home teacher for my girls too, and really done great for them. They're very lucky to have her. But anyhow, the problems are that kids can get this disease, and occasionally they can have bad outcomes and die from it.
Yes.
And also, they can be asymptomatic or minor symptom carriers and can bring it home to other family members who might be at higher risk, including the elderly. Many people are blessed to be able to live in multi-generational homes with their grandparents and be a positive influence on their lives as they're growing up. And you know, we don't want to bring a really bad gift home to grandma or grandpa.
That's right. We agree with you. As you may not know this, but the city of Pharr was the first city to implement an emergency mandate, and we recognize, based on the health experts, that children, although we love them to death, they can carry a lot of bugs, and people don't know it because they have very good immune systems. Some don't, and they get rashes. Kawasaki disease is one thing that people keep bringing it up is happening to kids. But we knew that population, unknowns to the family members, because in our community, we tend to have multi-generations at home, grandparents, uncles, and so forth that hang around a lot. And so as a city, we're very worried that you're going to have contamination, cross-contamination. That's the way we worded it, the fact between, and they don't mean to, but they will be affecting other populations, your loved ones, your neighbors. And so we did exactly that. You know what, let's go ahead and shut schools down. No school can open in the city of Pharr until further notice, because it was an evolving pandemic, right? And so that's what we did based on your experts like yourself and you're used to telling us that, this could be a potential carrier. And so some parents then always tell us, well, look, Mayor, why don't you just solve the problem for us? Why don't you just test everybody? And so then we get into a more delicate discussion Well, okay, and so if you can help us out here, gentlemen, what kind of tests are out there, number one? And not only, we'll get into the antibody in a little bit, but immediately, what do we have available to us in the United States and in this area? And risk benefits to it, and also, what is UTRGV's role in it? And I'd like to get your comments on that.
Of course. Well, in the early stages of the pandemic, testing, good, reliable testing was a scarce medical resource. And so it had to be carefully rationed to be used in areas where it would have the most impact and do the most good. At this point, thank goodness, testing is more available, although I wouldn't say it's on demand still at this point. I am very, very immensely proud of UTRGV for being able to stand up from scratch a clinical laboratory. It's one of the really cool things about having a university in the region is we happened to have a renowned virologist, not in the School of Medicine, but actually in another college at the university. His name is John Thomas. And Dr. Thomas had been looking at PCR and DNA, genetic material,
Yes, sir.
and other kinds of viruses in human tissue for a long time right here. And he just raised his hand and said, I'd like to help. So we worked with him through the School of Medicine. He actually has now come over for part of his time to be our clinical lab director. We worked with him to set up a test and to start testing dozens of people per day. It's gone so well, and there's been such demand that we're about to expand.
Good.
We'll expand to several hundred tests per day, and we are able then to test more first responders, people who are at risk but not showing symptoms, people who want to return to work and want to make sure that they don't have the
Yes.
disease. We'll be able to test more, as long as the supplies hold out. And all indicators are that they will. But supply chain is always a concern
Sure.
in a crisis time
Now, some
like this.
people have this notion of, that are obviously not in the healthcare profession, and it's not fault of their own, but what exactly we tend to use we use acronyms. We tend to abbreviate a lot in the medical profession.
Have I been doing that?
Rt-Pcr. And so when we discuss with the public, we can test it. Some people quite aren't sure what does testing mean? What's with this swab that's supposed to be 3 feet long, or is it just
Yes.
supposed to be in your mouth? Or what are we talking about? What is RT-PCR? And why can't you just buy at HEB? Why you just can't get this done? What's the deal there?
Sure. Well, PCR stands for polymerase chain reaction, which that also is a mouthful and kind of confusing and doesn't mean that much, just to say it. But here's basically how it happens. A virus goes to a particular part of the body and kind of lives there. One of the places where this virus lives is in the back of the throat, the back of the nose, back of the throat, the pharynx. So you get a swab. It's not that long. It's, about that long.
Yes, sir.
Right through the nose, right to the back of the throat. Trained professional can do a real quick swab and do this. Put it into a tube that has stuff in it that is, pretty good food for viruses.
Yes, sir.
Not exactly food, but it allows it to be
Right.
transported and live.
Right.
Then it goes into the laboratory where it's extracted using chemicals. Most of it is waste, and you get a little piece of it that goes into almost what looks like a cupcake pan,
Right.
but, about the size of your hand.
Some people describe it like a piece of Jell-O, kind of flat plate Jell-O where it's
Yeah,
going to run.
That's a good description. And in there, the stuff, the basic building blocks of genetic material will bind to that virus genetic material that you've extracted through
Right.
use of chemicals and amplify and amplify. You just keep growing it and growing it until it's enough that you can actually detect it, to your own eyes, basically.
Right.
And then you know that it's in there. You know that there was virus in that sample, even if there was just a few little particles. You know that it's there, and you know that that person has the disease.
That almost sounds like, just like making a cake. I mean, it's pretty simple. So those reagents must be all over the place. So you must not have a problem, and you should be able to test everybody given those ingredients and reagents. Are they readily available? Are you guys limited, or?
Yeah, it's also kind of a scarce resource. I mean,
It
this is a
is,
relatively
okay.
new disease, and so to get the reagents, well, I think everyone is familiar with the laws of supply and demand.
Yes, sir.
Huge demand right now for these reagents, which is another kind of big word, which
Yes,
just
sir.
means the chemicals that we have to use
That's right.
to do the test. There's a demand all over the country, all over the world for them, and while companies that make them are stepping up production, they can still be a little scarce. So far, we're able to get what we need.
So that is a big limiting factor when the university embarks on wanting to test 1.5 million people in the Rio Grande Valley. It's not lack of effort, it's the fact that there's some limiting blocks, such as reagents, that have to be readily available to you gentlemen for your university to be able to test people.
And skilled personnel, we simplified it in our discussion, but to actually do this well and not contaminate it and get bad results, you got to be really good at this.
Yes, sir. And we've seen not only in our community, but throughout the Rio Grande Valley, there's concerns about number one, well, how accurate is the test? I mean, if I get tested and I'm not showing up that I have this Rt-Pcr, be positive, I can tell my parents and my loved ones, I don't got it, I'm good, it's 100%. Is that an accurate statement?
It's probably not 100%, but it is very sensitive if it's done in a good laboratory that really keeps high standards. Dr. Thomas's laboratory uses an assay, kind of a recipe, that was approved by the Centers for Disease Control, and he's worked with the CDC for years. I would trust a test in a laboratory like that very, very, very highly. He and I have talked about this several times, and he's confident that he can pick up just a very few viruses
Right.
to actually get a positive test. But implicit in your question as well was, oh, if I'm negative, am I good to go?
That's right.
No. Think of it like a snapshot
Okay.
as opposed to a movie, which is your life. So at that snapshot in time, yeah, you're clear. And then you might leave and go breathe it in somewhere,
That's right.
through exposure to someone, and then you're not clear anymore.
Yes.
So, no, it's really a matter of getting a snapshot test to know you're clear or know that you have it. And then over time, doing what you need to do to reduce your risk of getting it or getting it again.
Yes. Now, you represent the University of Texas Rio Grande Valley Medical School and the system in itself. Obviously, it goes without saying, you're the leading experts in this area. We have had in our communities also some private sector companies come in. There's last I counted, about 14 different types of testing material that are out there, people doing. But I would, as mayor, I would urge you, please be sure that you check the accuracy, also check the credibility of the organizations. People charge for this. Are you gentlemen currently as an organization charging the public if they're wanting to be tested for this, or how does this work?
Well, here's how it works. We do have costs associated with doing the test.
Absolutely.
Buying the materials, the reagents, the machine to do this, it's not cheap. But what we're able to do is if someone has no means to pay, they don't have a payer, an insurer.
Yes, absolutely.
We don't charge them anything. We don't charge anyone anything out of pocket, by the way. But if someone has insurance, we will bill their insurance company. And to be frank, we are also hopeful that when the dust settles on all this, that the federal government will on the back end, help us out with some of the costs that we put in for testing the uninsured.
Yes.
I said something a few minutes ago, by the way, and that is get the disease again, that we have to come back to a little bit later with antibody testing.
Yes. Well, that goes into our next question, because you have the COVID-19 rapid tests, as they call them, the RT tests, PCR. Then some commentaries have come up at City Hall when it comes to, well, you know, Doc, you didn't test everybody. There's about 85,000, 100,000 people in Pharr, but you know you should do what LA County does, what New York is doing. Why don't you just check the antibodies, those little things that go around in your body? Because, you know, if I have it, I should be able to get out of jail card and run around with no mask, I don't have to wash my hands, I'm good. Can you expand a little bit of what these antibodies are and what IgG, IgM, and, you know, when people get them, when they don't, and does that really mean you're immune?
Those are excellent questions. You know, something I noticed some of the major health bodies saying here and there is no evidence that, and they might say that you are immune after you're exposed. I don't like using that term, but I would actually rather say we don't know everything.
Yes.
Here's what we really think. We think that if you have COVID-19, we think that you develop immunity to it, and that for a time, you will be at a reduced risk of getting the disease, maybe a very substantially reduced risk.
And also probably your response will be faster, isn't it?
Maybe so,
Maybe.
yeah. And we hope that that reduced risk lasts a long time. It's doubtful that it's lifetime, and it's possible that it's like the flu, where you get it this year, you have immunity to that particular strain of the virus, that type of the virus, and then next year, it changes a little bit and you aren't immune anymore. It could be like that. We don't know. But you
Okay.
asked, what are antibodies? That's really the question that a lot of people are asking these days. When you're exposed to a virus and it gets in your system, viruses have to have somewhere to live, another living being, a living being. Some people debate whether viruses are alive or not, but viruses have to have a living being to grow in. When a virus gets in your body, your own immune system, your white blood cells, naturally are going to attack it. They see it as something foreign, something potentially dangerous. They will attack it. They have a few different ways of doing that.
So it's like sending the police in when these, or a firefighter, when see a fire, you know what, we're gonna go after it.
Yeah,
Your body reacts to it.
It is like that.
Okay.
And actually, if you want to teach kids about the immune system, I would recommend a movie called Osmosis Jones, which came out several
Osmosis
years
Jones,
ago. Yeah,
okay.
it's actually quite good for that. So anyway, it sends out these cells, some of which will basically shoot antibodies at it. And they'll learn. They'll learn about this virus, and then after you get better from it, the next time it shows up in your body, they are on it before it can make you sick.
So they build memory to it.
They build memory.
I see.
Yeah, so they'll send the virtual immunity SWAT units right there to nip it in the bud, and you won't get sick from it.
Is that the difference between IgG, IgM that people refer to? Or?
Sure, okay. IgM often happens earlier in the infection, and then IgG antibodies, which are basically, it's just a different kind of molecule.
Yes, sir.
They're the ones that stick around for a long, long time and signify likely immunity.
Got it. So it's the IgG that people refer to all the time, that when they're looking for you've been exposed at some point in your life, that's what not that it infers immunity, but also that's the memory cell, the B cell, as they call it, that will be in your circulation. And so if you were to get it again, maybe you're not going to get as sick, but you possibly, if you get exposed, it can react sooner and much faster now, because it's in the memory.
It's really cool and really, really amazing. Those B cells, those cells that have memorized that antibody, man, they can live for decades, unlike most of your other blood cells.
Yes, sir.
They are truly extraordinary. And you talked about IgM, IgG. I mean, there's also IgA antibodies, which tend to be more out on the surface a little bit more. The immune system is really a gloriously complex and wonderfully effective system in keeping us alive.
Right. So
And
how do
safe.
we find out, one other question I get from our constituents is, well, why don't you just test everyone, figure out who has his antibodies, and make a bank of it. And so when I were to get sick or my neighbor gets sick, why don't you just use that? I mean, is it that simple to test you for antibody? Is it, I don't know what it costs. I don't know if you can share that. And is
So-
that theory?
Are you talking about serum therapy? Like,
I think so, sir. Yes, that's what they refer to.
yeah, that's pretty neat stuff. It doesn't always work, but basically you're talking about taking someone's plasma out of their blood,
Yes.
who's already been infected and has a good immune system and these antibodies for it, and purifying it and making it into really a biological product that can be used to treat other people.
Okay.
It's a great concept. I don't know what to say, except it's not a magic bullet, though.
It's just a tool, isn't it?
It's just one of the many things that are in the arsenal of medical care. I mean, of course, we don't have really great treatments to just kill the virus. We don't have,
do not.
Using this term loosely, antibiotics, really, I'd say
Yes, sir.
antivirals, to kill it. But, serum therapy is very interesting as an idea. I'd love to see more research done on it and more outcomes from people that are trying it so that we'll know how effective it really is in the long term.
Well, we've been discussing it with our county officials, the county judge, and for this area, it's Precinct 2, Igg Antibodies. We've been talking with the fact that the city of Pharr and other cities, I'm sure, but we for sure have been pushing the fact that we need this study done in the Rio Grande Valley.
Yeah.
How it gets done, we'll let the experts sort that out, but it's something we need to look at from a financial contribution, because at the end of the day, it helps everyone.
Yeah, it
And
does.
it'll be another tool to fight this virus. We currently have, if I understand it correctly, doctor, we currently have supportive measures only to treat you. We need to get you through the complications that could theoretically happen to you, but if we can treat you sooner and keep you from winding up in the ICU, we all would be happier if that were to happen. So that's something the city of Pharr is looking into as well. So I just want to make sure people understand then, if people have, and first of all, they get tested for the IgG, that does not mean they have a free ticket to run around and they will never get sick from this disease again.
Unfortunately, that's true. But what I will say is this. If you have positive IgG to the virus, the odds are certainly in your favor that you have some pretty good immunity to it, at least in the short term. And it's the best information that we have as far as one being immune, so that they can get back to a more normal life.
Got it. And when our population started with outbreaks in the city of Pharr, we've been notified about population outbreaks. And people from the county, and then, of course, us in healthcare, immediately asked, well, we need to trace these people. Let's trace.
Yeah.
And so can you expand a little bit on what that means for the general population? What is tracing?
Of course. Happy to. Contact tracing.
Mm-hmm.
So this would mean that if, let's go back to your, healthy, fit 22-year-old. Your healthy, fit 22-year-old gets a little bit sick, and they get tested, and they have COVID-19.
Okay.
So the way contact tracing would work would be that someone who knows what they're doing, like someone from the health department, like an epidemiologist.
Right.
They've been doing a great job on this, by the way. There's just the potential that there will be a lot more contact tracing than is needed than the resources that are available in anywhere, really.
Yes.
So the way that it works is that really smart epidemiologist interviews that 22-year-old and figures out where they've been and who they've come into contact with. And then that epidemiologist calls them up and says, you've been exposed. Do you have any symptoms? You need to isolate yourself. And this is why. And they do that with all their contacts. Let's say that the 22-year-old infected their 45-year-old mother. Well, then they need to do an interview to that mother and say, where have you been? Who have you come into contact with? And basically put kind of a protective cocoon of distance around these folks so that they're not passing the virus on to other people. It gets into your business a little bit and gets into privacy and questions of privacy. Individual freedoms, which are important to Americans. I've come to terms with it, and I'm comfortable with contact tracing because it's really about public health and protecting the greater good in this circumstance. So people really shouldn't be afraid of going through contact tracing.
Right.
The intent is never to invade someone's privacy, but really just to put that protective cocoon around them so that disease doesn't pass further and doesn't infect more people and cause really a serious epidemic, to
Right.
pandemic.
Yes, and we agree with you. And it's been our view in the city of Pharr. That's why we implemented our emergency mandate. You know, obviously, our freedom is a priority. Our view is very simple. If you, by chance, are going to harm somebody else, all bets are off. All bets are off. We're going to do what's best to protect the entire community in the Rio Grande Valley, specifically the city of Pharr. And if that means we're going to quarantine you, we're going to quarantine you. And that's because it's, number one, we need those 2 weeks to be sure people stop infecting other people. We don't need you running around, putting other lives at risk. You wouldn't want that if it was you or your family members either. So you should appreciate. And first of all, that's the kind of community we have in Pharr. We're very family-oriented, God-loving community, and we want to protect everybody in our community. So it's come up very few times, I have to say, and everybody in the community needs to understand that we have laws to protect your privacy, HIPAA laws, and unless you're in healthcare, don't worry, your information will not get shared with anyone. We worked out an agreement with the county officials, so we know when people are affected in the city of Pharr, and we know who's going to be quarantined, and we've not had not one person not comply with the self-quarantine. They've been very open, very nice individuals to work with, I have to say.
Says a lot about the government here in Pharr and the county officials and really the community, you know, that's turned out that way.
Yes.
Not every community across the country could say that everybody's been compliant.
That's right. Yeah, well, I think once people tend to have a better perception of it, once it affects you personally or affects a loved one, then all of a sudden people's tone and perception tends to change.
Yeah.
But here we've been very fortunate. I can tell you without a doubt that the city of Pharr residents have been compliant, and they've been a team player. Everybody cares about that elderly population, their parents, their grandparents, their great-grandparents. Some even have that. They're blessed to have that. That we're not going to let them be sacrificed at the altar just because I want to go by and run around. We don't work that way. And so it's been a very easy task for the city of Pharr to achieve, just so you know. Any other topics that you gentlemen either want to elaborate on?
Well, I'd just like to add that, you know, we've seen a similar response from our campus community. We had to make a lot of drastic changes in the middle of the semester. I mean, think about it. In the middle of a semester, we moved over 5,000 courses from face-to-face to online. But our guiding principles were the safety of our campus community and the safety of the community at large. We didn't want our students or our faculty or staff to be infected and take that home. And our second guiding principle was to make sure our students were successful during this time.
Yes.
And so, you know, today is exactly 1 week away from the end of the spring semester. And when I think about where we started 6 weeks ago and the drastic decisions we have to make, I'm so proud of the response of all our campus community. You know, we're a week away from the end of the spring semester, and our enrollment numbers for summer are higher now than they were last summer. And so the response has been amazing from our campus community, and we're taking momentum into the summer. And when you think about everything we had to go through to be in that situation is just amazing and a testament to the hard work, the dedication, the resiliency of our students, our faculty, and our staff.
That's wonderful. Now, when you guys, we know it's an evolving disease, and as time moves forward, we get more information from all over the world, and specifically for us here in the United States, the Rio Grande Valley, that pertains to us. Docs, are you seeing a change in how people present, or does everybody present like a cookie cutter same way, or what are you seeing out there?
We are learning a lot more about this disease every day. I mean, if you think about it, Mayor Doctor, you know, we've only had a few months to learn about this, and just the amount of knowledge that is accumulating is astronomical. One of the weird things about this disease, which doesn't seem that weird to me as a neurologist.
Yes, sir.
But one of the weird things about this disease is that in some people, the only symptom you might have is loss of taste, which isn't because you've lost your taste. It's because you've lost your sense of smell, because sense of taste is mostly sense of smell. The virus just goes up into the top of the nose and affects those cells that convey smell information to the brain.
So do people really just come in and tell, you know what, I can't, I'm biting into my chicken salad or sandwich and I can't taste it? Is that what they typically say?
Yeah, they would say that, or things taste weird, things taste funny. And
Okay.
then if you have it in your office, if you're seeing them in person,
Yes.
you could actually just put something under their nose to see if they can smell it. I'm a neurologist. I carry my bag with me sometimes, and I actually have stuff in there to do that. And they won't be able to. Or they
Fascinating.
could test it on their own at home, really.
Okay.
You know, if you were doing telemedicine, you could
Sure.
say, go to the cabinet and get some cinnamon and see if you can actually smell it.
Okay.
I mean, other things too, and this one's more deadly, more insidious. One of the things you got to really watch out for in the COVID-19 patient is they might be feeling okay, but their lips are getting blue.
Wow.
Maybe their face is getting a little blue. It's because they're just not noticing how poor their oxygen exchange and how poorly the oxygen is getting into their body and getting processed with this virus. And people can go just really down the tubes fast from that. So if someone is at home with COVID-19 and they're starting to get that, I mean, like maybe their family is saying, you know, your lips are a little blue. Go.
That's a big deal.
It is a big deal. You need to go
Okay.
get checked right then. You know, breathing difficulty, bluish discoloration, chest pain, severe confusion because you're not getting enough oxygen up to the brain.
Okay.
Those are really bad signs.
Headaches, fevers, is that still a common
Sure.
sign? That,
Yeah, those
okay.
are common. Those are common. But these ones are ones where you would say a hospital now.
Got
You
it.
know,
Okay.
headache, fever, calling it tested. Real serious trouble breathing, bluish discoloration, chest pain and pressure, coughing up blood,
Gosh.
confusion.
Mhm.
Go to the hospital.
It's still, so the best course of action when you see any of this symptoms show up for a patient is
Call 911 and go
Call
to the
911, call your doctor. If
Yeah.
need be, go to the hospital immediately. That's still the best course of action. Don't sit at home. Don't try and treat it with teas or home remedies.
If
That's
it's
not the time.
If it's getting severe, you know, most cases can be managed from home.
I understand. And speaking of management, how are you guys going to be faring in the fall when it comes to management of your students? Are you guys opening up the campuses? Are you guys going to go online, or what exactly are you guys going to do?
We haven't made a decision yet if we're going face-to-face or 100% online. We still want to monitor the situation. You know, we still want time to kind of see how the pandemic progresses. But we have made a commitment to put 25% of our fall academic offerings online. And we're doing that for two reasons. One, if we do find out in July that we have to go back to shelter at home or we have to go online, it won't be such a radical transition for us as it was in the spring.
I see.
But number two, we also know there might be some students out there who aren't ready to come back in the fall. Because if we come back in the fall, it'll most likely be with some type of safety protocol, mask, or some social distancing. And we know there are students who aren't mentally ready to do that yet, but still want to continue their education. So right now, we are devoting 25% of our fall offerings online in preparation for these things.
And for the students that wish to come back, say physically, are you, as a university, offering personal protection equipment? Are you mandating it, or how's that going to work out?
If the equipment's being mandated by the state or a county or a city order, we feel like it's on us to have to provide that type of protection. For example, a few weeks ago when the counties did pass the orders for face masks, we still have employees and some students who access our campus. And so we quickly provided them with bandanas or something that could cover their mask, because we knew that we had some folks who still had to come to campus,
Sure.
our essential employees.
Right.
And so if it's anything that's been mandated by the state or by county or city, we're going to try our best to provide that type of equipment and protection.
Right. I ask you that because I'm sure both gentlemen know the governor's orders taking effect very soon. And I just want to be sure that the university, people know, the public knows, those that are going to be thinking about going back physically and or online, as you pointed out, that the university is taking proactive measures in preparation for the new order kicking in. Obviously, not everybody has internet. The cities are trying to deal with that to be sure they have the proper infrastructure. We ourselves are working with the school districts to be sure we help them with the internet for the city of Pharr, because we know broadband is very important in access. Is there any other services or assistance you're providing to your students?
Oh, absolutely. We are completely focused on helping the challenges head on that our students are facing. We know our students are facing challenges academically, financially, and emotionally. And so everything that we are doing right now is to help with those challenges head on. And so financially, Mayor, a few weeks ago, we announced what we call the summer relief package. And so we announced that we would go online for the summer, but we also told students that if you enroll in 6 hours, which is full-time in the summer, you can do 3 one summer session and 3 another session. As long as it's 6 hours total, we're going to give you $1,000 off your tuition. And that's every student.
Every student, regardless of economics.
Regardless of economic. And we're going to throw in some incentives. If you do the 6 hours, if you complete the 6 hours, when we come back in the fall, we're going to cover your parking. You know how big parking is on the university campus?
It is.
And we're going to give you...
You guys have parking?
Believe it or not, we do. And we're going to throw in a $100 voucher that students, when they do come back, can use for dining, can use for books, and all that stuff. And it was so well received, we purposely named it the relief package because we knew our students wanted relief. And that has played a major role in us having more students enrolled now than we did at the same time last year in the summer. And to be able to say that in this type of environment is amazing. There's not too many universities across the country who are looking at an increase in enrollment in the summer. And we truly think this relief package has really helped.
Well, we have a lot of things in common. And one of the things the city does, and I think tomorrow, will be we help the food bank here, Hernandez Valley Food Bank, but also the city also is, on its own, we typically will go and help people out, and we're handing out quite a bit of food because, as you all know, with the economics of what they are right now, it's hard for people to pay their bills. It's hard for people to buy their groceries, and everybody's hunkered down, and it's very nice to hear and quite relieved. I remember when I was a student, I can't tell you how many hamburgers I ate off my meal plan, but I loved it. And the fact that you guys are going above and beyond that to help the community, this is your community, without being prompted to do so speaks volumes of your leadership and what the university's view is of our community. So thank you for that.
Yes, sir. Well, our message is simple to our students. Their success is our success. And so we're going to do everything in our power to make sure that they continue their academic progress. It's real easy during a time like this to say, you know what, I'm just going to take the summer off, I'm going to take the fall off, but we all know it's hard to get back going. So we're going to try everything we can to keep them going. We know they have challenges, so we're addressing those challenges specifically. Something else that we started when the pandemic started, what was going was our student emergency fund. And so this is a separate fund that we've built up through private donations and fundraising that go directly to students who are experiencing financial hardship during this time. So there's a criteria and an application you have to fill out, but we've given out tens and thousands of dollars just in the last few weeks. We continue to get applications from students, and it's everything from I need help paying my rent, I need groceries this month. We're providing those funds.
Right. Yeah, that's outstanding. It's really amazing. And you're right. We're in evolving times, and as the government orders kicks in and phase 1 kicks in with 25% of retail opening up, there's going to be a lot of movement out there. There's also concerns, because we really don't know what's going to happen. But Doc, are you, in your mind, should people be concerned that this movement or opening of retail and more human contact, should we expect a spike? Is that normal? We know the flu season's coming up also. How does that all come into play?
Well, it's possible. It is possible. While the peak may be passed on the the cases in the Rio Grande Valley, it's still out there. It's still out there, and with increased human contact, you could get spikes, and without good management, you could get another peak, and you could actually have another epidemic in the worst case, and, things really getting out of control.
Right.
So what's important is to continue reasonable social distancing. It's important to keep your hands clean,
Yes, sir.
wash your hands frequently, still avoid touching your mouth and nose if your hands aren't clean. And I just can't stress the importance enough of that contact tracing. When someone does get it, when you find it, when they're tested positive, isolate, trace, and stop the disease from progressing into a bigger cluster of cases
Right.
and a serious public health problem in that local area.
And on that topic, some people believe that what we have been doing is trying to cure the virus by staying at home and washing our hands. And could you elaborate? I mean, are these efforts, when people say mitigate versus curing, is the intent of social distancing, washing our hands, covering our mouth, mask, or what have you, is that really meant to cure the virus, or what's it really? What's the goal there?
Well, the goal is to avoid that virus getting into let me rephrase this, to keep that virus from getting into living human hosts by staying away from individuals who have the virus in their body. And so this social distancing is what does that. I mean, you stay at home, you stay several feet away from each other, the risk of contracting the virus goes down dramatically. In the long term, it becomes very difficult to sustain that kind of behavior in a human society. But in the short term, wow, the number of cases that we've prevented, the number of lives that we've saved is just staggering, really.
And that's what when I discussed with our citizens in Pharr, I said, the success rate that we're measuring really is, I know you guys, some people think that, well, where's this big pow, where's this big excitement that we actually made a difference? Well, the fact that we didn't flood our hospitals, the fact that we don't have thousands upon thousands of dead bodies in our community does point to the fact that the efforts and the recommendations that the professionals, the medical school has put out.
And elected officials, I mean, really, you all put it out on the line and really made those tough choices.
Yes, sir. That's how you measure success. We don't want our ICUs full. We don't want our hospitals full.
No.
And we certainly don't want, we want people to have long, normal lives, not cut short. And that's really, in my opinion, the mortality rate is what, if you're going to measure something, measure that. You know what? Yes, it's going to stay here, right? It's not going to go away. It's going to be with us now, like any other virus, until a vaccine gets made, which reminds me, is there one really coming, or?
I hope so. I really hope so. I mean, vaccines are currently being tested, and I think that's one of the things we really have a lot to be proud of in the United States of America is our industry that is capable of actually standing up these vaccines pretty quickly and getting them through appropriate testing, and our FDA, which keeps that in check and keeps us all safe. So the best case scenario that I've heard is maybe toward the beginning of the new year, and I'm a January baby, so maybe around my birthday I'll get vaccinated. That'll be one of the best birthday presents I've ever had, actually, if I could get a COVID-19 vaccination on my birthday. And I hope so, and I hope that the vaccine is one of those like measles or for chickenpox that confers long-term immunity. I hope it's not like the flu where you got to get a new shot every year.
But it might be, right?
But it might be. But it might be. And I really hope that it's not one of those diseases where a vaccine just doesn't work out. I mean, there are viruses out there that we would love to have a vaccine for, and we don't.
That's right. You're absolutely right. Well, great, gentlemen. As we wrap this up and close up, I'm going to give you guys the floor, each individually, to say your closing comments, anything you'd like to share with the population, your constituents for UTRGV, because this is where you a lot of our students come from, but also they come from Mexico also and all around. And so with that, I'll allow you to speak first.
Well, first of all, again, Mayor, thank you for having us. And I'd really like to direct my message to our students.
Good.
We're here for you. We want you to stay engaged with the university. We want you to continue your education progress. We know these are difficult times. We know these are unknown times, but together we can get through it. We've already shown that we can in the spring, and we look forward to having another successful summer session and a fall session, and just continuing with our focus on student success.
Wonderful. Thank you.
Well, I would also like to thank you and the city of Pharr for hosting us today and giving us this opportunity to talk about COVID-19, and I hope keep people safer. So my message would be directed to the public at large, and that is to, in the midst of this pandemic, which is ongoing, stay calm, stay safe, be thankful for what you have. Listen to your public health officials and elected officials, because their main aim in all this is to keep you safe and to keep you disease-free.
Wonderful. Well, ladies and gentlemen, thank you for joining us today. And gentlemen, thank you for coming out here. They have a very busy schedule. As you know, they're part of the medical school, and now we clearly can all appreciate, if you haven't done yet, why it's so important for us to have a strong university, a strong medical school, not only for production of doctors and also the research, but you're actually seeing, as it happens live, why we need to have a medical school, that we need to have these specialized resources, doctors, laboratory technicians, and the funding for it in order for us to save our own lives, and let alone we're going to save the rest of the world, because we collaborate very well. The city has always been a strong supporter of education, whether it be at the high school level, the college level, medical school level, and it will continue to be that way, because we believe strongly that education is a great equalizer, and they are at the forefront. They have the tools to get it done. They work with all the health capacity that's in the community, whether it's Dr. Hospital Renaissance or Valley Baptist. They're actively working in our community, as far as Stark County as well, mind you, trying to save your lives, trying to produce a reliable product, whether it be testing or future doctors, nurses, physical therapists. They're here for you. So when you see these gentlemen or young ladies walking around with that logo, remember, this is your medical school. This is your university. Vaqueros, you should be very proud of them, of the work that they do. And on behalf of the mayor and the entire commission and the citizens of Pharr, we're very delighted that you took the time out of your busy schedule and to educate us and spend time with our community. And we will always be here to support you. And with that, thank you very much for joining us.